Hi, my name is Nur Ayan Najwa binti Muhammad Zairi and my metric number is P4240045. And today I will be introducing you to an important health condition which is chronic obstructive pulmonary disease, or we call it as COPD. In this presentation, we will take a closer look at what COPD is and its common symptoms, the causes and risk factors, available treatments and medications, how to properly use an inhaler, and important precautions for managing the condition. C stands for chronic, which is describe how it doesn't go away. O stands for obstructive, which is describe the way it makes breathing difficult. P and D stand for pulmonary disease, means it affects the lung. Overall, COPD stands for chronic obstructive. COPD is a chronic respiratory disease that results in difficulty breathing due to narrowing of the airways within the lungs. It is a progressive disease, which means that it gets worse over time. There are two primary types of COPD, which is emphysema and chronic bronchitis. Emphysema occurs when the tiny air sacs in the lung are destroyed, leaving irreparable holes that can make you short of breath. Besides, COPD that causes inflamed airways and mucus production and coughing is called chronic bronchitis. People with COPD can have emphysema, chronic bronchitis, or both. Next is causes. Most of the time, smoking is the cause of COPD, as particles from tobacco smoke inflame and irritate the lungs. However, COPD does occur in non-smokers too. Besides, exposure to secondhand smoke, living in a polluted and exposure to chemical fumes and dust can also cause COPD. Next, let's talk about the symptoms of COPD. These are the warning signs that show something may be wrong with a person's lung. This lung change cause the key symptoms of COPD like breathlessness, wheeze, cough, and phlegm. The symptoms worsen gradually over time, making daily activities harder. But when COPD is mild, you may not have symptoms. Now that we've discussed the symptoms, let's talk about how COPD is diagnosed. There are a few tests and methods used to find out if a person has this condition. You should see your doctor if you have these symptoms, as early treatment of COPD can make a big difference. So how is COPD diagnosed and treated? After checking your symptoms, doctor can arrange breathing tests to see how hard and how fast you can blow out air from your lungs. If you are found to have COPD, doctors will recommend the most appropriate treatment to help with symptoms and control the disease. If you are diagnosed with COPD, the first and most important thing to do is stop smoking. This is the only way to keep COPD from getting worse. Also, exercising regularly can keep your lungs healthy and strong. Once someone is diagnosed with COPD, treatment becomes very important. There are several ways to help control symptoms and improve breathing. If necessary, your doctor will prescribe an inhaler to help you breathe. If COPD gets worse, you might need oxygen. COPD cannot be cured, but it can be managed if caught and treated yearly. Many people with COPD live long and fulfilling life, especially if they stop smoking. Treatment for COPD focus on managing symptoms and improving quality of life. Although COPD cannot be cured, it can be controlled, especially if diagnosed and treated yearly. Doctors often prescribe inhaler, which contain medication that help open the airways and reduce inflammation, making it easier to breathe. It's important to use the inhaler correctly, as the technique is key to making sure the medicine works effectively. If COPD gets worse, oxygen therapy may also be needed to help with breathing. In addition to medication, people with COPD are encouraged to stop smoking, as this can greatly slow the disease progression. They should also get vaccinated to prevent chest infection like the flu or pneumonia, which can make symptoms worse. Finally, regular checkups are important to monitor progress and adjust treatment as needed. With the right care, many people with COPD can live long and fulfilling life. Now that we've discussed inhaler as a key part of COPD treatment, it's important to understand how to use them correctly. Proper technique ensure the medicine reaches the lung and works effectively. There are two main types of inhaler used in COPD treatment, and each one has a different purpose. One of the most common types of inhaler is the metered-dose inhaler, or MDI. It delivers a specific amount of medication in aerosol form with each puff. Here's how to use a metered-dose inhaler correctly. First, shake the inhaler well before use. Second, remove the cap and hold the inhaler upright. Third, breathe out fully to empty your lungs and place the mouthpiece in your mouth and seal your lips around it. Then, press down on the inhaler once as you begin to breathe in slowly and deeply. Hold your breath for about 10 seconds if you can. Next, remove the inhaler and breathe out slowly. Then, wait 30 seconds to 1 minute before taking a second puff if prescribed. Lastly, rinse your mouth, especially if using a steroid inhaler to prevent infection. Another common type of inhaler used in COPD treatment is the dry powder inhaler, or DPI. Unlike metered-dose inhaler, DPIs don't spray the medicine for you. You have to breathe in quickly and deeply to inhale the powder form of the medication. Here's how to use a dry powder inhaler correctly. First, open the inhaler as instructed. This may involve sliding, twisting, or clicking depending on the device. Second, load a dose if needed. Some DPIs require you to press a button or twist the base to prepare the dose. Third, breathe out fully away from the mouthpiece. Do not exhale into the device. Next, place the mouthpiece in your mouth and close your lips tightly around it. Then, inhale quickly and deeply through your mouth to draw the powder into your lung. Then, hold your breath for about 10 seconds if possible. Next, remove the inhaler and breathe out slowly. Then, close the device and store it properly. Lastly, rinse your mouth, especially if the medication contains steroids. To make sure inhalers are safe and effective, it's important to follow a few simple but essential precautions. The first one is do not overuse. Only use inhaler as prescribed by your doctor. Second, keep the inhaler clean and dry. Regularly wipe the mouthpiece and make sure no moisture gets inside, as this can affect the medication. Third, rinse your mouth after using a corticosteroid inhaler. This helps prevent infection. Fourth, store the inhaler properly. Keep it in a cool, dry place. Avoid exposing it to heat or direct sunlight, which can damage the medicine. Next, do not share your inhaler. Sharing can spread infection and may be dangerous. Lastly, check the medication name and dose before use. Always make sure you are using the correct inhaler and dosage to avoid mistake. Thank you for your attention. Awareness is the first step toward better health. Let's keep learning and sharing.